CEN Exam Prep Study Guide. Question 1. A patient with Crohn's disease is at increased risk for which complication? Option A, toxic megacolon. Option B, intestinal obstruction. Option C, perforation. Option D, fistula formation. The correct answer is option D, fistula formation. Crohn's disease is a transmural inflammatory process that often leads to fistula formation between bowel loops, skin, or other organs. Toxic megacolon, A, and perforation, C, are more common in ulcerative colitis. Intestinal obstruction, B, can occur in both, but fistula is more specific to Crohn's. Question 2. A patient is brought to the ED after a violent assault. What is the first priority in caring for this patient? Option A, obtain a forensic evidence collection kit. Option B, perform a thorough physical exam. Option C, ensure patient safety and medical stabilization. Option D, contact law enforcement. The correct answer is option C, ensure patient safety and medical stabilization. The ABCs in medical stabilization are the priority for any patient, including victims of violence. Forensic evidence collection, A, physical exam, B, and contacting law enforcement, D, are important but secondary to medical stabilization. Question 3. A patient presents with coffee minus ground emesis and melena. What is the priority nursing action? Option A, administer 4 fluids. Option B, insert a nasogastric tube. Option C, prepare for blood transfusion. Option D, assess airway and breathing. The correct answer is option D, assess airway and breathing. The ABCs take priority. Coffee minus ground emesis and melena indicate an upper GI bleed. The patient is at risk for aspiration and hypovolemic shock. Airway assessment and breathing are the first steps. 4 fluids, A, blood transfusion, C, and ing tube insertion, B, are important but secondary to airway assessment.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 4. A patient presents with a complaint of severe headache and photophobia. The patient has a temperature of 101 degrees Fahrenheit and neutral rigidity. Which triage category is most appropriate? Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. A patient with fever, neutral rigidity, and photophobia is at high risk for meningitis and requires rapid assessment, ESI 2. The patient is not unstable enough for ESI 1A, but needs to be seen quickly. Question 5. A patient presents with a patellar dislocation. The nurse should monitor for associated injury to the Option A, femoral artery. Option B, sciatic nerve. Option C, popliteal artery. Option D, tibial nerve. The correct answer is option C, popliteal artery. Patellar dislocation can cause injury to the popliteal artery, which lies behind the knee joint. The nurse should assess distal pulses and capillary refill. Femoral artery, A, is more proximal. Sciatic nerve, B, is more posterior. Tibial nerve, D, is also in the popliteal area, but the popliteal artery is the most critical vascular structure. Question 6. During a disaster drill, which patient should be prioritized for evacuation? Option A, patient with a fractured femur who is stable. Option B, patient on a ventilator. Option C, patient with a minor head laceration. Option D, patient with a sprained ankle. The correct answer is option B, patient on a ventilator. In a disaster evacuation, patients who are ventilator-minus dependent are the highest priority due to their reliance on life-minus sustaining equipment and difficulty in moving them. Stable fracture patients, A, and minor injuries, C, D, can wait. Question 7. A patient with a urinary tract infection presents with confusion and fever. What is the most likely diagnosis? Option A, uncomplicated UTI. Option B, pyelonephritis. Option C, urosepsis. Option D, interstitial cystitis. The correct answer is option C, urosepsis. Confusion and fever in a patient with a UTI, especially in an older adult, suggests urosepsis. This is a life-threatening infection requiring immediate intervention. Uncomplicated UTI, A, does not cause confusion. Pyelonephritis, B, causes flank pain, fever, and chills. Interstitial cystitis, D, causes chronic pelvic pain. Question 8. A patient presents with stridor and drooling. What is the priority nursing action? Option A, assess the airway and prepare for possible intubation. Option B, obtain a lateral neck X-ray. Option C, administer nebulized epinephrine. Option D, administer 4 antibiotics. The correct answer is option A, assess the airway and prepare for possible intubation. Stridor with drooling in an adult suggests epiglottitis, a life-threatening airway emergency. The priority is to secure the airway. The patient should not be agitated or have a throat examination. Lateral neck X-rays, B, may delay care. Nebulized epinephrine, C, may be used for croup but is not appropriate for adult epiglottitis. Antibiotics, D, are important but secondary to airway management. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. In triaging a patient with abdominal pain and a fever of 102 degrees Fahrenheit, the nurse should assign which triage category based on the Emergency Severity Index, ESI. Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. ESI 2 is for high-risk patients who are not in immediate danger but require rapid assessment and treatment. A patient with fever, 102 degrees Fahrenheit, and abdominal pain meets criteria for ESI 2, high-risk. ESI 1A is for life-threatening conditions requiring immediate intervention. ESI 3C is for stable patients requiring 1-2 resources. ESI 4D is for stable patients requiring no resources. Question 10. A patient with suspected stroke has a blood pressure of 190/110 mmHg. What is the appropriate nursing action? Option A, administer 4 labetalol to lower blood pressure. Option B, administer 4 hydralazine. Option C, allow blood pressure to remain elevated unless there are signs of end-organ damage. Option D, administer a nitroprusside drip. The correct answer is option C, allow blood pressure to remain elevated unless there are signs of end-organ damage. In ischemic stroke, elevated blood pressure is often compensatory to maintain cerebral perfusion to penumbral tissue. Current guidelines recommend against lowering blood pressure unless it is extremely high, greater than or equal to 220/120, or the patient is receiving thrombolytics. This patient does not qualify for intervention yet. Options A, B, and D are not recommended unless criteria are met. Question 11. A patient with a history of DVT presents with sudden onset of chest pain and dyspnea. What is the priority nursing action? Option A, administer oxygen. Option B, obtain a 12-lead ECG. Option C, prepare for CT angiography. Option D, administer heparin. The correct answer is option A, administer oxygen. The ABCs are the priority. Administering oxygen to treat hypoxemia is the first step. ECG, B, is used to rule out ME but is secondary. CT angiography, C, is diagnostic but not the priority. Heparin, D, is treatment but follows oxygen and diagnosis. Question 12. A patient is bitten by a venomous snake. What is the priority nursing action? Option A, apply a tourniquet above the bite. Option B, immobilize the affected limb. Option C, administer antivenom immediately. Option D, incise and suction the wound. The correct answer is option B, immobilize the affected limb. Immobilizing the affected limb and keeping it at or below heart level helps reduce venom spread. Tourniquets, A, are contraindicated as they can cause ischemia and tissue necrosis. Antivenom, C, is administered after assessment and only for systemic toxicity. Incision and suction, D, are no longer recommended and can cause further tissue damage. Question 13. A patient is diagnosed with acute appendicitis. The nurse is particularly concerned if the patient reports which symptom. Option A, sudden relief of pain. Option B, nausea and vomiting. Option C, right lower quadrant pain. Option D, rebound tenderness. The correct answer is option A, sudden relief of pain. Sudden relief of pain in a patient with suspected appendicitis may indicate perforation of the appendix. This is a serious complication requiring immediate surgical intervention. Nausea and vomiting, B, right lower quadrant pain, C, and rebound tenderness, D, are all expected findings in appendicitis. Question 14. A patient presents with acute kidney injury. Which laboratory finding is most consistent with prerenal azotemia? Option A, Bun/CR ratio 20:1. Option B, Bun/CR ratio 10:1. Option C, normal Bun/CR ratio. Option D, elevated CR with normal Bun. The correct answer is option A, Bun/CR ratio 20:1. In prerenal azotemia, decreased renal perfusion, the Bun/CR ratio is typically 20:1 due to increased reabsorption of urea. In intrinsic renal disease, the ratio is typically 10:1, B. Normal ratio, C, and elevated CR only, D, are not characteristic of prerenal azotemia. Question 15. A patient is scheduled for an abdominal CT with oral contrast. Which finding in the patient's history may require special preparation or alternative imaging? Option A, diabetes mellitus. Option B, hypertension. Option C, allergy to shellfish or iodine contrast. Option D, asthma. The correct answer is option C, allergy to shellfish or iodine contrast. Allergy to shellfish or iodine contrast is a concern due to cross-reactivity with 4 contrast agents. Pre-medication with steroids and antihistamines may be needed. Diabetes, A, and hypertension, B, are less significant. Asthma, D, is relevant but less directly impactful. Question 16. The possibility of an ectopic pregnancy increases when a patient has a history of Option A, breast cancer. Option B, endometriosis. Option C, teenage pregnancy. Option D, pelvic inflammatory disease. The correct answer is option D, pelvic inflammatory disease. Pelvic inflammatory disease, PID, can cause scarring and damage to the fallopian tubes, increasing the risk of ectopic pregnancy. Endometriosis, B, can increase risk, but PID is the most significant risk factor of these options. Breast cancer, A, and teenage pregnancy, C, are not risk factors. Question 17. A patient with heart failure presents with acute pulmonary edema. The nurse anticipates which initial medication? Option A, for furosemide. Option B, for morphine sulfate. Option C, for nitroglycerin. Option D, for dobutamine. The correct answer is option C, for nitroglycerin. For acute pulmonary edema, for nitroglycerin is often the first-line medication as it causes venous and arterial vasodilation, reducing preload and afterload, and quickly relieving symptoms. Furosemide, A, is used for diuresis but takes longer to work. Morphine, B, is used cautiously and is not typically first-line. Dobutamine, D, is for cardiogenic shock with low cardiac output. Question 18. A patient presents to the emergency department reporting slurred speech and an unsteady gait for about 6 hours with complete resolution of the symptoms. Which of the following statements by the patient would be a priority to follow up? Option A, I haven't been able to refill my blood pressure medication for a few weeks. Option B, I use cannabidiol, CBD, edibles to help me sleep. Option C, I was diagnosed with Guillain-Barré syndrome as a child. Option D, my grandmother had rheumatic heart disease. The correct answer is option A, I haven't been able to refill my blood pressure medication for a few weeks. This patient's symptoms describe a transient ischemic attack, TIA. Uncontrolled hypertension is a major risk factor for future stroke and requires immediate intervention. While CBD B may be important, it is not as critical as uncontrolled hypertension for TIA management. GIA-C can cause similar symptoms but is not the priority. Family history of rheumatic heart disease, D, is less relevant. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with COPD is receiving supplemental oxygen. The nurse is most concerned if the patient's oxygen saturation is maintained at which level? Option A, 88-92%. Option B, 93-95%. Option C, 96-100%. Option D, 85-88%. The correct answer is option C, 96-100%. In COPD patients, the goal is to maintain oxygen saturation between 88-92%. Excessive oxygen can suppress the hypoxic drive and lead to hypercapnic respiratory failure. A saturation of 96-100% is too high and may worsen ventilation in these patients. Saturation below 88%, D, is too low. Question 20. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO3 24 milliequivalent/L. What is the most likely interpretation? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option C, respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO2. Question 21. A patient with an open fracture of the tibia is brought to the ED. What is the priority nursing intervention? Option A, administer 4 antibiotics. Option B, cover the wound with a sterile dressing. Option C, check distal pulses and sensation. Option D, apply a splint. The correct answer is option C, check distal pulses and sensation. In any fracture, especially open fractures, neurovascular assessment distal to the injury is the priority. Checking pulses and sensation ensures there is no vascular compromise or nerve injury. For antibiotics, A, wound dressing, B, and splinting, D, are important but secondary to neurovascular assessment. Question 22. A patient in her second trimester of pregnancy presents with painless vaginal bleeding. What is the priority assessment? Option A, fetal heart tones. Option B, maternal vital signs. Option C, cervical dilation. Option D, contraction pattern. The correct answer is option B, maternal vital signs. Painless vaginal bleeding in the second or third trimester is concerning for placenta previa. Maternal hemodynamic status is the priority. Assessment of fetal heart tones, A, and contraction pattern, D, are important but secondary. Cervical examination, C, is contraindicated until placenta previa is ruled out due to risk of catastrophic hemorrhage. Question 23. A patient presents with sudden onset of sharp chest pain and dyspnea following a long flight. What is the most likely diagnosis? Option A, spontaneous pneumothorax. Option B, pulmonary embolism. Option C, acute coronary syndrome. Option D, pericarditis. The correct answer is option B, pulmonary embolism. This patient has risk factors, prolonged immobility from a long flight, and classic symptoms of pulmonary embolism, sudden dyspnea and pleuritic chest pain. While spontaneous pneumothorax, A, can cause similar symptoms, the history of prolonged travel makes PE more likely. ACS, C, presents with chest pressure with radiation. Pericarditis, D, pain is positional. Question 24. Which of the following is a contraindication to the use of continuous positive airway pressure, CPAP, in a patient with respiratory distress? Option A, COPD exacerbation. Option B, hypoxemia. Option C, confusion or inability to protect the airway. Option D, mild asthma exacerbation. The correct answer is option C, confusion or inability to protect the airway. CPAP requires a patient who can protect their own airway. A confused patient or one with an unprotected airway is at risk for aspiration and should not receive CPAP. COPD exacerbation, A, is an appropriate indication, as are hypoxemia, B, and asthma exacerbation, D, with caution. Question 25. A patient with a known history of diverticulitis presents with fever and severe left lower quadrant pain. Which assessment finding is most concerning? Option A, abdominal guarding. Option B, rebound tenderness. Option C, rigid, board-like abdomen. Option D, a flatulence. The correct answer is option C, rigid, board-like abdomen. A rigid, board-like abdomen in a patient with diverticulitis suggests perforation with peritonitis, a surgical emergency. Abdominal guarding, A, and rebound tenderness, B, are also signs of peritoneal irritation but are less severe than board-like rigidity. Flatulence, D, is not concerning.